Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it only makes sense to have the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I am now seeing patients and clients all over the world virtually, so make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. Today's episode, I had the opportunity to interview an esteemed colleague, Dr. Rob Kachko. In this episode, we talk about how naturopathic medicine can play a significant role in integrative care, optimizing patient outcomes during this COVID crisis and beyond. This is an extremely important episode, and I really hope you all get a chance to listen to this and share it with your friends, because it is so important to get naturopathic medicine to be on the mainstream, on the forefront, because we can play a very significant role. And in this episode, we get into how we can play that role. So please make sure to tune in and share with your friends. A little bit about Dr. Robert Kachko. He is a naturopathic physician and a licensed acupuncturist. He practices in New York City and is the current president of the American Association of Naturopathic Physicians and the past board member of the New York Association of Naturopathic Physicians. He graduated from the University of Bridgeport College of Naturopathic Medicine and Acupuncture Institute. He's received additional training in clinical hypnotherapy, biofeedback, somatic experiencing, and incorporates these mind-body techniques to help his patients connect more effectively with themselves and their own needs. Dr. Kachko is also co-founder of TribeRx, which is a comprehensive biopsychosocial approach to chronic pain that utilizes peer support and technology to help patients feel better understood and more effectively supported. This is a really cool project, by the way. You definitely need to check out this side note. But when he's not working, he loves exploring Brooklyn with his puppy Maya and a good audiobook, staying active indoors and out, and spending time with family and friends. Dr. Kachko has been a patient advocate for so many years before he actually became president of our organization, and I'm extremely grateful that I get to call him my colleague, and I'm glad that he was able to squeeze in some time with his really busy schedule, especially during this time, for the show. So thank you so much, Dr. Kachko, and I really hope you all enjoy this episode, and like I said, please share with your friends and family, and let's get this out there. This is super, super important. Let's make this medicine mainstream. Let's make this accessible to all of our friends and family members, and not just those who are living in some of the bigger cities or whatever it may be. This needs to be something that everyone has access to. So make sure to share this episode, and definitely leave comments or reach out to Dr. Kachko or myself after the show. All right, I will let you get straight to the episode. Enjoy.
Hello, Dr. Kachko. How are you doing today?
Very good. How are you? Thanks for
I'm
having
doing.
me.
Yeah, thank you for joining me today. I'm really excited to have you. Okay, let's get started on the interview. Tell us, so I ask all of my guests this question, what got you into naturopathic medicine? Tell us a little bit about your journey.
Sure. I'll give you the short version of it to save us some time. You know, I found, especially with a lot of my classmates in naturopathic medical school, there's this common theme that they saw this medicine work for themselves or for someone they love. And my experience was just the same. I was an EMT in high school. When we were learning to take pulses, I had an arrhythmia, discovered that the arrhythmia wasn't really a great one through a couple of cardiology visits. They really had no answers for me. They were telling me to avoid caffeine, come back if you start fainting. Wasn't really a good solution for us. So we actually went to a Chinese medicine practitioner. At the time, I didn't know anything about naturopathic medicine. To this day, I don't know exactly what it was that he did. I wasn't really tuned into it so much at that point, but he practiced, we didn't do any acupuncture or anything like that. He practiced in a naturopathic-like sense. And 2 months later, I went back to the cardiologist, and I was fine. They said, wow, it's gone. We're not sure why, but keep doing whatever you were doing, which is a common thing we hear, right, with our patients.
Yes.
And So that just got me reading probably way too many medical anthropology books for a 17, 18-year-old kid, trying to figure out, well, there's this other approach to the body that honors the body's process. I was interested in Chinese medicine. I read The Web That Has No Weaver by Ted Kapchuk around that time. And just that approach of thinking about the body in a nonlinear way was really intriguing to me. And then in parallel, I was, at the time I said I was an EMT, and I was really struggling with the fact that our job was to get someone to the hospital, sort of keep them alive. And then we never got to hear their story, what it was, what were the factors in their life that brought them there outside of like a car accident. What if someone had a chronic disease, a heart attack, what was it that actually brought them there? And when I discovered naturopathic medicine, I really appreciated this idea that we get to share people's journey, right? We walk the journey with them. We really hear their story. I'm doing that today. First visits are an hour and a half. Follow-ups are an hour. I feel very fortunate to have that opportunity with patients. So right after undergrad, I went to naturopathic medical school. I kind of knew all the way through undergrad.
Wow. Yeah. It is so beautiful to be able to share that story with our patients. It's just so gratifying.
Yeah. Yeah.
Okay. So my next question is, how did you get involved in the legislation aspect of naturopathic medicine? And can you tell us a little bit about your journey to becoming the president of the American Association of Naturopathic Physicians?
Sure. I think it's a common theme, and for most people, that the things we end up doing, we don't really choose. They sort of just evolve. And I don't know if I can say they choose us, but they evolve into that. And so my story is kind of the same. I almost reluctantly raised my hand to be class president freshman or first year of naturopathic medical school. That turned into NMSA work, the Naturopathic Medical Student Association. We started our chapter there. The University of Bridgeport College of Naturopathic Medicine didn't have one at the time. And then that got me connected with the AANP. I was the student rep, ran for the board just because I was really intrigued by the work of the AANP. I really understood that if we don't have a strong national voice, this idea that if we don't have a seat at the table, we're probably what's for dinner. And so I really, really felt like naturopathic medicine had so much potential, and we needed a strong national association to do that. So that's why I ran for the board, actually as a student. And then after 2 terms on the board, I was ready to be done. I'm in New York City. I was about to focus all my attention on state licensure to make sure that NDs are licensed and fully regulated in New York State. And then I got a call from the nominations committee to ask me to run for president. And I said, absolutely not. I don't have the time for that. I need to focus on practice and all those things. And then somehow, proceeded to ask questions about it for 30 minutes. And then a few weeks later, decided to run. So.
Oh, wow. That's so fun. Yeah, it is crazy how that works. We're like, whenever we're resistant, sometimes that's really just what we need to be doing.
Yeah. And I think the way I inevitably convinced myself was, I think all of healthcare, but our profession in particular, is at a really important moment in terms of how do we look inward and how do we coalesce as a profession around our commonalities, but also how do we look at the general healthcare landscape and understand where we need to be. And it feels like unless we're thoughtful and we're doing this with intention, it feels like 20 years from now, we can look back at this moment and say, well, here's where our profession went in one direction or the other. And so I felt like if I have an opportunity to be involved in that process to try to make sure that we sort of maintain the heart of our medicine, that I couldn't pass it up. And so here we are.
Yeah, definitely. It was really cool. I just recently saw, I don't know if you saw the recent issue of Time Magazine. Did you see that?
I'm not sure that I did.
Well, it was really cool because on the front cover, it said alternative medicine, the new mainstream. So clearly tides are really shifting into this direction. And I rarely buy magazines, but I definitely bought that one.
Yeah, frame it. I think it's happening because of consumer demand. People want it. Most doctors, their patients are using these types of approaches. I don't love the idea of alternative medicine in general. I think that there's the right medicine for each person at the right time. I always say if I go get hit by a bus, don't send me to an ND. But if I have a modifiable chronic disease, I think a naturopathic doctor should, or naturopathic physician should be on my healthcare team. And so I don't really consider it an alternative. I just consider it a part of the necessary team. So integrative, some people don't love that word either, but integrative kind of addresses that.
Yeah, definitely. Yeah, I completely agree with that. I don't actually like the term alternative medicine either. Yeah, I think the integrative medicine really encompasses that more. So just using whatever you need at whatever time, I think is obviously ideal. So with that said, can you give us a little bit, like a brief description, like our elevator pitch on the training of naturopathic physicians?
Sure. So NDs go to a typical 4-year medical school experience, trained to the level of primary care providers, where we do learn, I'd say, everything that conventional docs do in terms of the standard biomedicine approach, inclusive of pharmacology, but then we take sort of a yes and approach and we bring in nutritional medicine and botanical medicine and physical medicine, rehab, and mind-body techniques, where we're really helping patients use the least invasive means when possible, depending on where they are on their health journey when they come in to see us. So, and I think that's probably the quickest elevator pitch. If people want to know more about naturopathic medicine and the training we get, if you go to AANMC.org, that's the Association of Accredited Naturopathic Medical Colleges. There's information about all of our schools, the accreditation that we have,
the licensing exams that we need to take in order to become naturopathic physicians. Yeah, it has all of those details. So I'll make sure to put those that in the show notes. But I also want to refer people to, I interviewed Dr. Griffin McMath, and we went into a lot of detail on this. I think this was my second episode on the podcast. So it was way back when, and we go into all of the detail on our training and what it takes to get accredited, what it takes to get licensed, and all of that stuff. So if anyone's interested in learning more, I definitely recommend going to that and then reaching out or like looking at these resources as well.
That's great. And Dr. McMath is a great advocate for our profession. So that's perfect. We'll defer to her on that one.
She's great. Okay, so let's get into how it's different in a licensed state versus an unlicensed state, because I'm in Ohio right now, and so that's definitely a struggle with some of my patients, and they ask me like, why we don't have the licensure right now. And so yeah, let's get into how practicing is different for naturopathic physicians in different states.
Sure. Well, I think one of the most common questions we get at the AANP is, why can't we just have sort of national licensure or regional licensure? And though we'd love for that to be possible, unfortunately, the states are in full control of scopes of practice and licensure and regulation. And even within licensed states, we've got some states that have been licensed since 1919. Washington State, Connecticut's been licensed since 1922. These are bills that have been on the books for a long time. And then we've got states that have been licensed in the last couple of years. And the tide is really shifting. But there's a wide range of the type of scope of practice that we have even in licensed states. So in some places like Vermont, we're full primary care. In other states, we are considered more like specialists, but still with the ability to diagnose and treat. Similarly, our scope of practice is different in terms of prescription authority and ability to do injectables and things like that. In unlicensed states, or what we like to describe as pre-licensed states, truly it's the Wild West. We talked earlier about this idea that there's a lot of consumer confusion or consumer demand for the type of medicine we practice, but that comes also with a lot of consumer confusion. People have family in California or in Arizona where maybe they have been to a licensed naturopathic physician and they think that their state should have that, rightfully so, right? I'll give the example that I have. I live in New York City. I have an acupuncture practice in New York City, and then I'm a licensed naturopathic physician in the state of Connecticut. I have patients literally go across the border for me to be able to be their physician. And that's a challenge because for most patients who are interested in this type of medicine, they don't know the difference between a licensed ND and someone who calls themselves a naturopath. And so in states where we're not yet licensed, there's really no title protection, and there's no clarification for people who are interested in receiving care from an ND that someone went to a fully accredited 4-year naturopathic medical school with actual patient contacts, as opposed to doing online training and things like that. Now, that's not to say that there isn't a lot of benefit maybe from things like health coaching and nutritional support and traditional naturopathy, but it's very clearly not the type of training you need to be able to be a physician to know what's appropriate when. And so what we're working on in pre-licensed states is ensuring that people know the difference and can get the support they need, because we often serve as a bridge into the rest of the healthcare system for a lot of the people who want to see us. However, we are still, even if in Ohio, for example, even if you're not practicing as a full scope physician like your training allows you to do in other states, we can still help people. I think that's the important message, right? We're limited in terms of our ability to diagnose and treat in the classic sense. You're not able to do blood work, you're not able to do the right physical exams that you're trained to do. But from a therapeutic modality standpoint, and from the perspective of natural therapeutics, we can help people with the understanding of what's required as a physician to do that in a safe and effective way, right? And so we can help people stratify into the healthcare system as necessary.
Definitely. And I think that's really important that you bring up the scope in terms of like the lay naturopath versus a naturopathic doctor or health coaches and things like that. And they always obviously have so many benefits and can be very helpful and supportive, but understanding that there is a different level of training. I was talking to, I can't remember if he was a life coach or a health coach, but he told me that he had told this person who was just diagnosed with pancreatic cancer not to do chemotherapy. And that was very scary to me because he knows nothing about that and he hasn't been trained in that. And that would need to be a discussion that you would have with the oncologist, and that could be very dangerous for the patient. And so this is why I think that having that title protection can be really, really helpful in maintaining that patient safety.
I mean, I'm in New York. There's a school up in, I think it's in Queens, that's promising on their website to teach people how to cure cancer in a weekend. You know, that's concerning, right? And that wouldn't be possible if we had the type of regulation we need in the state. And so on an AANP level, we're supporting the state associations to be able to do that as effectively as possible. So if anyone's listening and is a state leader or an aspiring state leader, please do reach out. We're sort of ready, willing, and able to support as proactively as possible.
Yeah, definitely. Awesome. Okay, so in this current crisis that we're in, the COVID-19 pandemic that we're currently dealing with, how do you feel like naturopathic doctors or physicians can be supportive or play a role in this current pandemic?
Yeah. So I think it depends on the stage within which we find the patient that comes in to see us or reaches out via telehealth. Certainly NDs at this point are not sort of frontline ICU care, but we have so much that we can offer. You know, I just saw a report out of a Boston area homeless shelter that looked at percentages of infections. I think they said half of the I think 300 or 400 people that they tested positive for COVID, not a single one with symptoms. And so clearly there are people walking around in our society right now that have been exposed to this particular coronavirus and are not showing symptoms. So that there's one category of what can we do from a preventative standpoint, from an immune resilience standpoint. That's where naturopathic medicine shines, right? Helping people be resilient to chronic disease, but also to infection, helping their immune systems work more effectively through appropriate nutrition and making sure they get the right nutrients in for their immune system to work effectively, making sure that people sleep better. You know, something like, I think the best study I had seen said just 1 week of sleeping 5 hours a night increases risk of similar viruses, it hasn't been studied for this virus, 300 to 400%. pretty significant. So helping people sleep is a core tenet of naturopathic medicine, right? People are stressed, they're anxious. If they're having existential crises, their immune system isn't working the way that they would like it to. And so NDs really shine from the mind-body medicine perspective. Similarly, we really value the role of physical activity and the role of community in terms of turning on the immune system. There's just a pure prevention stage there. When people are infected, even with mild symptoms, we really have an important role to play as a stage 2 in terms of keeping them out of the hospital. So much had been said about the need to flatten the curve so that hospitals and ICUs aren't inundated with too many patients at the same time. NDs absolutely have a necessary toolkit to keep people out of the hospital. Our tradition from a historical perspective very much confirms that. And we have a lot of tools in our toolkit that are useful for similar types of viruses. So absolutely, we can keep people out of the hospital. And that's where telehealth really comes in. I think that's probably the most important medium through which we can do that, because we want to make sure that we're not, contributing to community spread. We're not using up PPE and things like that. So that's stage 2. Between stages 2 and 3 is people who are in the hospital who are having severe symptoms. And even if that's a small percentage of the population, it's a percentage of the population that needs to be addressed. We have a lot to say from that perspective in terms of, like we just put out an IV vitamin C statement based on past research on reduced mortality, reduced need for mechanical ventilation in ICU stays, so that we can do that. Hopefully when people recover, something that isn't really talked about very often right now is what are these people dealing with when they recover from the virus, hopefully, and they leave the hospital. And that's stage 3, where I think NDs can do a really great job, again, utilizing our entire toolkit to address chronic health and chronic disease and applying it to immune resilience, again, but from the perspective of helping people to recover. And then there's sort of an overarching idea in terms of what we can be doing beyond those 3 stages of NDs. I think there's an important public health conversation to be had about who is and is not susceptible. And so early on, we were hearing all about comorbidity, right? People with diabetes and heart disease and hypertension and immune susceptibilities. Again, that's chronic disease that we shine with, right? Mm-hmm. Diabetes is a reversible chronic disease. We can do a lot for that. And so in terms of keeping our public safe, we need to be involved in all the policy decisions, and we're working on being involved in all the policy decisions to ensure that state and local and federal municipalities are helping their citizens address these things. Big picture, this thing isn't going away very quickly, but if we can have a healthier population, that's great. And then also, I think as NDs, we take a slightly different lens. We take a more holistic lens as to what contributes to people's health outcomes. And we're seeing very clearly that there are pretty strong socioeconomic determinants of who is susceptible for a variety of reasons, some related to access, some related to comorbidities and chronic disease. Naturopathic medicine can really shine in these communities as well. And so from a public health standpoint, we need to be there. We need to make sure we're contributing to the conversation.
Definitely. I wanted to mention that when you talked about the immune support in general and how we can help people prevention is really the best medicine. And I was watching The Daily Show actually, and Trevor Noah was talking about how prevention sounds boring, but it's really effective. And I feel like that really is a lot of what prevention is. People aren't excited to talk about prevention all the time, but it is very, very effective. And this is why we're social distancing ourselves and washing our hands more regularly, and taking all these precautions, because it is effective. And that's where naturopathic medicine really, really shines. And then on the other side, where people have chronic diseases, which I think is about 60% of Americans have some type of chronic disease, at least one. And so that means about 60% of Americans are more susceptible. And that is where we can really help people reverse these conditions. And then the other point that you made that I wanted to comment on was when people are in the hospital, or if they are in the hospital, then the IV vitamin C. I did interview Dr. Paul Anderson, who's kind of spearheaded a lot of the research and translation of the research. And so, so if anyone's interested in that, make sure you check out that episode, because we go into way more detail on the research and how that can be effective, and how that can benefit those who may actually be in the hospital with COVID.
Yeah, and Dr. Anderson has been great. He contributed to the development of our statement. In fact, he sort of initiated that statement. Really early on when this started, AANP put together a COVID-19 specific task force, and he's been on the task force, and we've got a lot of other great docs who are contributing to that as well.
Oh, that's great. Okay, and then my next question was, so I think a lot, especially with conventional medicine, a lot of people are concerned with like herb-drug interactions or nutrient-drug interactions, and those are very fair concerns because they do exist. So can you talk a little bit on how naturopathic physicians can be supportive in that realm as well?
Yeah, one of the things I often tell my patients when they come in and they told me, well, Dr. Oz told me to take, these 20 pills. Natural doesn't always mean safe. And frankly, whether most docs like it or not, their patients are taking these things, and they're often not telling their doctors. And naturopathic physicians are the only physician level providers who are trained in understanding how these things are impacting, right? There are sort of interaction checkers, but we understand the mechanisms of our toolkit very well, and we're trained on pharmacology. So truly, there's no healthcare provider that's better able to navigate these things. That's why having, we said this earlier, having an ND on your healthcare team is essential. That's like one of the tiny reasons why, but it's an important one, especially right now, because, I had a patient the other day who watched some kind of webinar and started taking 250,000 IUs of vitamin A per day.
Ooh.
Not very safe. There's a lot of interactions there. There's a lot of liver impact that we're going to worry about. And so if they don't have someone to reach out to personalize these recommendations for them, that's where we run into some real trouble, especially with things like fat soluble vitamins that build up in the system. So
yeah. Oh yeah. That gives me a little bit of anxiety there. But yeah, that is exactly it, where we can we help people streamline all of this noise and information. We're in a world of information. Most of it is not legitimate. Some of it is, right? So so just like streamlining, and then what works for you as an individual as well, and figuring that out. And yeah, I've had very similar situations. I've actually had situations where patients have a number of different specialists, and so they have a cardiologist and a neurologist and a gastroenterologist, and they have a number of different medications they're on, and those actually end up interacting with one another. And this is another part where, because we have the time to spend with them, like you said, we have like an hour at least to spend with our patients, then we get to know all of this a little bit more, and we can kind of streamline it and be like, oh, okay, this one might be interacting with this one. And then usually for me, at least in Ohio, I end up just calling the doctors and talking about like which ones can we change out, and having that conversation as well.
super important. We have to be advocates for our patients. I think that's one of the most important roles we can play is and I just as an aside, I'm amazed at how often people come in with a diagnosis or a medication they're on, and they have no idea why they're taking it or how it works.
Right.
And so a lot of what we have to do is just educate our patients so that they feel empowered to help themselves. There's just volumes of research on the fact that if someone doesn't feel high levels of self-efficacy, they're much less likely to get better. They're much less likely to make the behavioral changes necessary. And aside from the content of what we tell people, just the very fact that they feel like they can help themselves is super important for their journey.
Definitely. I actually love that part in Docere, where doctor is teacher. I love that part. I will sit down and explain like the mechanism of action of how these herbs or supplements are working in someone's body, so that, and people get really excited about it. And you're absolutely right, because that does help with efficacy and compliance, and that's obviously the goal.
Right. Totally.
Yeah. Okay, so I'm going to kind of shift gears. Let's talk a little bit about research. So we talked a lot about the clinical side of things and how naturopathic physicians can be involved there, but how can naturopathic physicians be more involved in research, and what role can they play there?
It's a great question. It's something, frankly, we're going to need to develop more and more of in our profession. We know our medicine works. We know that we're combining um, determinants of health that work, right? The idea of helping people digest their food well, or sleep well, or move their bodies, or think the right way, or relate the right way. All that matters. But the truth is, if we're going to have the type of national and global health impact that we know our medicine can, and the attention that it deserves, we're going to have to validate that in larger trials. And one of the challenges often is, the gold standard randomized controlled trial tries to isolate the one factor that's contributing to someone getting better against placebo. And there's a lot of validity in that. The challenge is, in naturopathic medicine, there are multiple factors that we're changing at once. And frankly, we can't even separate out the relationship that we have with the patient in terms of helping them feel heard and understood in terms of how that contributes. That, alongside all of our modalities in our toolkit, has to be assessed from a whole person naturopathic medical care perspective. So that's the type of research we really need to be doing. We do need to be validating our tools in those randomized placebo-controlled trials in parallel, but learning how to write up case studies as like lowest hanging fruit is essential. And the schools have research departments that are doing this work. And so I encourage any of the NDs or ND students to connect with a local school and their research team and find out, maybe there's a study you can do within your clinic that they would help you formulate and support. And just to give a very timely plug, the Health God Institute at NUNM has put out, and Dr. Ryan Bradley is the lead on this, has put out a clinical case registry for COVID patients, where we can start to collect data on the types of modalities that people are using for diagnosed and confirmed cases, and then track them over time to make sure that we're confirming the fact that our medicine is working. Because frankly, we see it working. We see that we're keeping people out of the hospital. We need to validate that.
Yeah. Yeah, that's a really cool study. I'm excited that NUNM is doing that. Is that open to the entire nation, or is it more localized to Portland, Oregon?
Yeah, it's in fact, it's not only open to NDs. I think it's open to all types of integrative healthcare providers. You just have to sort of list what type of provider you are.
Okay.
Maybe we can link that in the show notes as well.
Yeah,
link to the case registry.
Yeah, definitely. That's really cool. All right, well, that's all the main questions I have for you all right now. And before we get into the rapid fire questions, I just wanted to ask you if you had anything else that you would like to share with the audience before we move on.
Yeah, so many things come to mind. I think that there's so much uncertainty right now. I'm finding that what's helping my patients is a combination of, we mentioned this earlier, helping them feel heard and what they're experiencing, but also offering grounded, as in non-fear-based education around what are the facts, what do you need to consider, how do you separate the public health message about we need to activate people to, do the appropriate social distancing and wash their hands and all that, but the message internally shouldn't be one based in fear. It should be one based in hope that there are things that we're doing moving forward. And I'm finding that, especially because I've been talking about the role of social isolation in health outcomes for a couple of years at a startup, and we're trying to address this. I'm seeing especially the role that people sitting at home and changing their habits and getting out of their routine is having on their mental health. It's triggering their own wounds from the past. It's reliving past traumas. And I think we have this collective trauma that public health policy is going to need to take into account. When we have a populace that's frozen in terms of not knowing what's coming in the next couple of months or frankly years, that is absolutely turning on inflammatory cascades and changing their immune system and changing the likelihood that their body is going to turn on the right genetics for the right kinds of chronic disease. we need to be addressing this now. We need to give people the support they need. As NDs, we can do that on an essential, but on a small scale with our patients one-on-one in those hour-long visits. But we need to impact policy as well. And so I'm hoping we can be a part of that conversation.
Yeah, definitely. I always say that I think change happens on a very holistic level. And so for ourselves individually on a mind, body, and spirit holistic perspective, but also as a general whole, we need to make the small individual one-on-one changes, and then educating the public, right? This is ideally what my goal here is. And then also making changes in the legislation. So like, I feel like that is really the holistic perspective, like how we can make real change in this country.
Yeah.
Yeah. Okay. So, all right, let's get into the rapid fire questions and then I will let you go. I wanted to ask, so we talked a little bit about what Mahan Health means. Mahan means great. And so what does Mahan Health mean to you?
The first thing that comes to mind is sustainable health, right? This idea that we can make changes, but unless we make them over the long term and incorporate that into our lives, there's no such thing as Mahan there if it's a short-term change. So,
yeah. I like that. Okay, so the next two questions, they could be related, they could be completely different. It's kind of up to you, but I'm going to ask them together. What was the most difficult health change for you to make, and what are you currently still working on?
Regular meditation, I think for me was the most difficult to incorporate. I find that when I get stressed, that's ironically the first thing that goes away. But I've been better about it. And the thing that I'm working on right now is actually related. I'm working on doing much more sort of introspection and processing through journaling. I find that if I have to just create the habit, and it has to just, the journal has to be there wherever I know I'm going to be at a certain time of the day. Otherwise I won't do it. So I'm still working on that, but I find that looking inward is really important right now. So I'm trying to force myself.
Yeah, that's really cool. I feel like a lot of people can relate on, especially on the meditation part. That's definitely something that I struggled with for some time. And even now during this time, I'm like, oh, like I don't really need to meditate. But then whenever I do it, everything is just better. Like I just feel so much better.
Totally.
Okay, my last question is, if you could have a commercial like on health, a PSA that you can get out to the entire world, what would it be about and why?
So I've got, I alluded earlier, I've got a healthcare technology startup called TribeRx, where the idea is helping people feel heard and understood and connecting people with lived experience of different types of chronic disease, starting with chronic pain. And so I think my commercial would be this idea that when your doctor writes you a prescription for whatever, they're also writing you a prescription for social support and community. So some version of that is bouncing around in my head right now.
Yeah, I like that. And you have a book, right?
In the works.
Okay. Yeah. Well, tell us. Okay. So then let's finish with that. So tell us where people can find you. Yeah.
Yeah. So we started talking about the AANP. So if anyone's interested in the American Association of Naturopathic Physicians, you should visit naturopathic.org. You can find my personal website, drkachko.com, and also our practice, Inner Source Health. We're in Midtown Manhattan. The company that I mentioned is TribeRx. So it's www.triberx.com. And then on social, dr.kachko is the Instagram that, I'm not as good as you about actually keeping alive, but it's there.
You're fine. No, you post really great information. I think I saw the pain and the emotional connection. I thought that was really powerful. And so we definitely all appreciate your work, all of us naturopathic physicians, as well as the patients. So thank you so much for everything that you do.
And thank you for spreading this message to your community over and over. It's really important.
Of course. Yeah, of course. Thank you so much for joining me today.
Thank you, Dr. Patel.
All right, thanks. Bye.
I hope you all enjoyed that episode and now have a better understanding of how naturopathic medicine can play a significant role in this COVID crisis and in general for our healthcare system. I'll have Dr. Kachko's information and the resources we mentioned in the show notes below, so make sure to check those out. But that's all I got for you all today. Be sure to stay tuned for any call to actions we put out there to support our healthcare providers during this time. But for now, let's all do our part and physically distance ourselves from one another while staying connected wirelessly. Wishing you all Mahan health, and I'll see you next time.